After a shoulder dislocation, will your shoulder ever feel normal again? Does having surgery help it feel normal years later? My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my YouTube channel. Here's the question. I dislocated both of my shoulders. My left shoulder dislocated 6 years ago. I had to go through surgery. It did feel better after that, but the recovery took some time. But yes, it's better. A few days ago, I dislocated my right shoulder. I had it put back into place right away, but I haven't decided to go for surgery yet. My question is whether it will ever feel the same. Now, real quickly, before I answer that question, please remember this video and all of my videos, all of my blog posts, everything I answer, I am not giving medical advice. This is just meant for information and educational purposes. As far as will a shoulder dislocation ever feel normal, there's sort of two different answers. There's the if you have surgery and if you don't have surgery. If you don't have surgery, as I've talked about in a number of different videos, very, very often what develops is recurrent instability. It may not be outright dislocations over and over again, although the younger you are, teenage years, maybe early 20s, that does tend to happen, and easier each time you get full dislocations and you end up needing to have surgery. Or it has subluxations where the ball slides partly out of the socket, ball and socket, humeral head and glenoid, but you get the point. It slides partly out of place and it may be subtle, but it just doesn't feel right. You can do physical therapy and strengthen all the muscles around the shoulder, but very, very often the consequence is that shoulder just doesn't feel normal and you can't use it the way you want. And then again, a lot of times what happens is surgery becomes the necessary option. Now, again, the other side of that, will it feel normal after surgery? Fortunately, it's much more likely to feel normal. The stability, assuming the surgery goes well, everything works out well, there's no recurrent injury, but let's assume it goes well, recurrent instability is typically not a problem. Now, having said that, I saw somebody yesterday that had surgery on each of her shoulders, and yet she still had shoulder instability. Now, there were other factors involved, but yes, it can happen. But let's assume it goes well. You don't have recurrent instability. Typically, if there's an issue, it's more of a loss of range of motion, especially external rotation, because a lot of times you're tightening the anterior capsule and repairing the anterior and inferior labrum. And so external rotation is the issue. Physical therapy can help restore range of motion, and that's actually really important. But I do see that a lot of times as a consequence that you don't get all of your motion back. It's still good, it's just not perfect. A lot of people can do well, especially athletes, after that surgery and get back to 100%. But if there's an issue after a shoulder stabilization surgery, it's typically more loss of range of motion, maybe to a lesser extent, maybe a little bit of weakness and difficulty with overhead activities. But again, good rehab, good physical therapy can usually help overcome that. Now, if you want a copy of my recently written ebook, The Arthritis Solution, you can get it free by clicking the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, you can also click the link in the description under this video, fill out the contact form to learn more about scheduling an appointment with me. I'd also love to hear your experience with your injury. Leave those in the comments below this video. Just understand, if you leave a question in the comments, I can't offer you medical advice, but what I might do, like I did here, is I might answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks so much for watching, and I look forward to helping you feel, look, and perform better than ever.